And the next person signed up is, let me see, Patricia Crispy from the American Nurses Association.
Good morning. Good morning. Good morning, Chairs Jalen and Stanley and members of the committee. Thank you for the opportunity to provide testimony in support of House Bill 766, an act relative to acute hospital and nursing home governance. My name is Patricia Crispy. I'm a registered nurse and the current president of ANA Massachusetts, a constituent member of the American Nurses Association, the largest voluntary professional organization representing 5 million nurses nationally and over 130,000 registered nurses here in the Commonwealth. I also work in an acute care organization that has a respected nurse leader on their board of directors, a person who has influenced strategy and vision during these complex times in healthcare. ANA Mass submitted this bill in 2023 to mandate the establishment of at least one registered nurse member with full voting rights and privileges on the board of directors or trustees of all acute care facilities and nursing homes in the Commonwealth. This will ensure that chief executives and leaders are working in the best interests of the people they serve, especially our vulnerable older adults. We urge you to pass this bill because most of the acute care and nursing home facilities and health systems in the Commonwealth do not have a nurse on their current board. Appointing nurses to boards enhances diversity of ideas and a broader range of perspectives for the largest healthcare workforce. Nurses know and understand the communities they serve and have strategic influence over the health of our communities. Gerontological practice is a nursing specialty dedicated to improving the quality of older adults to optimize their care. Nurses' knowledge, expertise, and critical thinking skills will lead to boards making more effective operational, financial, and strategic decisions. Boards are enhanced by the unique perspective that nurses bring to the boardroom. Today's nurses have advanced skills in all aspects of quality care, patient safety, and healthcare administration. As we all know, keeping patients safe in acute care hospitals and nursing homes is paramount. Nurses tirelessly advocate for the physical, psychological, and spiritual health of patients and families. They are experts in standards of care, evidence-based practice, and innovation in healthcare delivery. Given the contributions of nurses, acute care and nursing home facilities in the Commonwealth would only benefit by the inclusion of a registered nurse to serve on their board. Thank you for the opportunity to testify in support of H766. I hope you will consider this bill favorably. Thank you.
Thank you for your testimony. Do we have questions? I do have a question. You mentioned assisted living as well. That's not in the title of the bill, and I haven't read it, so.
I'm sorry?
Does the bill include assisted living residences?
It would include long-term care facilities.
Any long-term care facility, and you're considering assisted living to be that?
I have a 91-year-old mother who currently resides in assisted living. I would be in full favor of having nurses on a governing board.
But does the bill cover that?
I will get the details and let you know.
So I recommend that you look into the status and definition of ALRs, because that is a question that has come up in that commission, and it's also a question of the definition of ALRs.
We will certainly provide that information, and we have provided written testimony as well.
Great.
So we'll make sure that that is clarified.
Thank you very much.
Thank you.
Oh, we do have a question.
Thank you very much for your testimony. You okay if you don't have the answer now, maybe you can help to provide it. But do we know how many hospitals and nursing homes already have a registered nurse as a sitting and voting member of the governing body, or percentage?
We do have a percentage. The exact number I don't have on the top of my head, but it's also very difficult to determine who has a nurse sitting on their board, because on websites of organizations, they don't often specify that it is a nurse on their board. So we have dug into the data a little bit, and I can get you that exact number for what we know.
Well, I think the idea is very interesting to ensure that there's people with health expertise for our seniors, as opposed to business people that don't have anything to do with providing long-term care. So it's, I don't know if there's a